Dear Lord, we thank you for the opportunity to come together and to think together, to pray together, to plan together, strategize together. And thank you for people who's willing to come together to analyze and examine what we are faced with at this point. Because we are in a pandemic now that is an equal opportunity offender, don't care nothing about anybody, anywhere, and will cause fear, suffering, and harm to everyone. And that has thrown most of us into a real tizzy. So please strengthen us to be the best that we can be. Let us read the messages as involved in this situation, and that all of us strive to be a better people. This I ask in your name, amen.
Amen. Thank you so much, Steve. So, Miss Parma Hardy from Lowndes County invited Miss Amy Yerkinen with AAL.com to be on the call to just kind of hear what we're doing. And so I have just been trying to give her an overview of what we do. Most of us on this call are members of Alabama New South Coalition, and we have formed an ad hoc arm of that we're calling right now the Black Belt Task Force. One of the reasons that we formed this task force is because, as you know, I'm sure, Ms. Yerkinen, that Black people are being adversely impacted with mortality during this pandemic. And we know that the Alabama Black Belt has some of the worst challenges in terms of access to health care, in terms of financial equity and those kinds of things. So we formed this task force to put our heads together to see how we can best help ourselves through this pandemic and beyond. So in a nutshell, that's why we're here. Any of our other members on the call are welcome to add to what I just said before we go into our county update.
I think that this is the senior down from Macon County, that we are embarking on a self-care model because we understand resources may be limited in so many ways and in so many different places. And so we have committed to joining our resources together to make life better for our people in the Black Belt.
Well, I wanted to thank y'all for having me, and right this current moment, I'm working on a story about rising cases in the Montgomery area, including Lowndes County. But I'm happy to hear, all of what y'all are talking about. And if I don't, write about it right away, it may be something that I call to follow up on at a later date. So again, thank you so much. And just let me know if anything just is off the record, or if whenever you need me to log off, so just in case y'all need to talk about anything that's more sensitive.
Okay. All right. So what we usually do is have people give updates by county. We have 3 people on the call from Macon County. I'm from Macon County, Leon Frazier and Lucinia Donna from Macon County. We have Carol Zipper from Greene County, who's a regular on these weekly calls, and someone who's new to the call but not new to us is Carrie Fulgham from Sumter County. So I'm going to ask if it's okay with you all to let Macon County go ahead and give its update, and then followed by Greene County, and then Carrie, if you would let us know what's going on with Sumter County. And if anyone else joins the call, we'll put them in line behind Carrie's report. If that's okay for us to proceed that way.
Sure.
Okay. All right, so Chief, I don't know if you want to give a piece of Macon County's update, or Lucinia, do you want to? Why don't we ask Lucinia to start? We'll let beauty before age this time. If that's okay.
Sorry, Chief. I think you're pretty too, so what can I say? Good evening, everybody, and I am happy to report that we had a wonderful conversation with the Macon County Public Health Department through Dr. Dina Maxwell, and she reported that they are now prepared to do coronavirus testing throughout Macon County on a regular basis. They are working out the schedule now, and they will let us know. They, however, have certain rules and regulations that they must adhere to, and so we are in the process of trying to figure out how we will do universal testing and test people prior to them having to go to the public health department. In other words, let me rephrase that in a better way. If we do pre-screening, if we screen prior to, and those people that meet the guidelines for the Macon County Public Health Department, then we will get them over to them through their process. We have not worked out all the details yet, and hopefully we will be able to tell you what that's going to be on the next call. But we are very, very excited about what we're doing to possibly help identify those people who are impacted or have been affected, and then being able to count more accurately the people in our county who have the coronavirus at the serious level, as well as those that meet the standard of being able to stay home for the 14 days.
Thank you, ma'am. I just want to add to that in addition to Macon County getting weekly screenings, Bullock County was also included in that. I don't know if that was Bob Turner that joined us or someone else who joined after we started.
This is Bernetta Perkins from Dallas County.
Welcome, Bernetta Perkins from Dallas County. Thank you. I just wanted to add that Bullock County is now included in the weekly screenings through the Alabama Department of Public Health. Mr. Frazier, you have anything else from Macon County?
Yes, I do. I would like to say that I'm glad to hear that Macon County now will be receiving weekly testing, and I want to praise Brother Frank Lee, our emergency management man, for having the attitude from the start that he was sick and tired of us being treated as second-class citizens. And with his attitude, many of us got busy and started not only articulating our attitudes and demands, but to activating our demands. And I'm certain that the caravans that we joined up with and did at the Montgomery, Alabama Capitol, sending the message to Governor Kay Ivey that their second-class approach toward treating us like unwanted stepchildren was unacceptable, and we really was not intending to take it anymore. And when she didn't seem to hear us the first time by us going around the Capitol seven times in order to associate with the walls of Jericho back in biblical days falling after people displayed their discomforts, we then took it to her house. It's called a mansion. She conveniently left just before we arrived. However, we sent some very serious messages in to the governor, and that is that not providing adequate testing for black people when black people are dying at an accelerated rate in this pandemic was just totally unacceptable. Not only that, but we made it clear to her that we had to have better safety equipment for agencies and entities within our black belt counties. Now, we never heard anything from Governor Kay Ivey, but it really doesn't matter to me whether she respond or say anything or not, as long as she has shaken that health department that had a very negative attitude about us from the start. As long as they have gotten in gear, and I believe she had something to do with that, well, then I am pleased. And the next thing that I'm pleased about is that these counties are getting together so that we can articulate not only our negative attitudes about stuff, but our positive attitudes about stuff that is happening in our counties and how we can struggle together to ensure that black people will be paid serious attention to throughout this pandemic. Go ahead.
Thank you, Chief. And I will just wrap up Macon County's report by letting you know, I'm going to just say Amy, if that's okay with you, letting you know that Macon County is one of the black belt counties that does not have a hospital. And so this is something that we're working really hard to do preventative measures with, so that we're not in a situation where we have an outbreak with no hospital. So that wraps up Macon County's report, and we're going to move on to Greene County. Someone else joined the call. Did I get your name?
Bob Turner.
Thank you, Bob Turner, from Bullock County.
Okay. Well, in Greene, we are having testing, but this week we had the state health department test, and it was today, and I don't know how many participated, but theirs is limiting because you have to have an appointment, and you have to have some symptoms. You have to be sick, or you have to have a referral from a doctor. So that keeps some folks away. Now, we have also been having testing by Maud Watley Health Center. They have a small clinic here in Greene County, so they have an obligation to us. And when they come to test, and they've been coming like every other week, they take everybody. They take first come, first serve. The only thing is they're limited on the number of tests that they can do on a particular day. Each time they come, they seem to have a little more. And also we have asked them not just to conduct the testing in Utah, the county seat, but to go out to some of the other little towns. So what I've heard is that they are scheduling the next one for the town of Union, Alabama, which is in the northern part of the county, for folks who couldn't come into town. That's like, 20 miles away or something. So that will be helpful for our folks if the testing so go shoot them. And we're still, I have ordered myself a lot of, I've ordered a bunch of disposable masks, because there are folks in grocery stores and in the dollar stores who walk in there without a mask. And I go there with my mask and gloves and give folk a mask, that don't have. When I ask them, where's your mask? They say, I forgot it. I left it home. It's in the car. And I said, well, here, would you put this on now so you can protect yourself and you can protect me? And there was, the clerk in the Family Dollar store today, I went in there for something. I had a mask and go up. The clerk I said, you cannot serve me without a mask. Oh, we got it. Would you please put it on? I said, to protect me and you. So we're still struggling with our folk really grasping, the dangerousness of this virus. And I tell folks my story over and over, that I was tested positive with no symptoms. But, and then I quarantined, and in 2 weeks I tested again, and I was negative. But doesn't mean that I can get it again. So I have a different perspective on it since that little experience. That you can tell folks you can be walking around with the virus. But this whole thing with the governor. Part of these demonstrations that have been going on in Montgomery, I haven't been gone, but John, my husband, he's been gone. He has gone to all of them. And really, we are trying to get the governor to expand Medicaid. That would be very helpful in fighting this COVID-19, especially for our rural hospitals, because that would give folks who are the working poor, who can't get insurance, the expansion of Medicaid would cover them. And our rural hospitals wouldn't have to be, like, for example, in Greene County, we are incurring $100,000 a month in uncompensated costs for care. And anyway, I guess that's basically what's happening in Greene County. We are still trying to get folks to take this seriously, wear masks, and stop congregating in your yards for barbecue parties.
That's pretty universal. We're having the same issues in Memphis. Yeah. Thank you for your report. I'm so glad that you're better.
Yeah, thank you. I talked with, regarding the nursing home, the hospital, we had talked about what facilities could we identify in our communities where if people have to quarantine outside of their homes, where could they go? We have space in our hospitals to quarantine, but that's additional cost that we would need, our hospital would need some resources for if it came to that. So I did contact and talk with folks, and they said that is a possibility. Using hospitals that way, they have individuals put one person to a room. And they could, but you got to feed them. You got to have other kinds of medical care available to them if they need it, and just the whole supervision of that floor. So that would be additional cost, to the hospital in light of the financial struggles that they're in already. But they're not ruling that out. That they're still open to considering that if it came to that, if we could even get folks, as I said last week, get folks to quarantine outside of their families. It's just difficult, so difficult with our folks. So that's basically where we are. So we've been having testing seemingly on a regular basis, except that the day that we have testing either from the health department or from Modern Wisely Health Services, it's limited for that day. They never have enough tests for the people who come.
Wow. Well,
and that doesn't seem to be any tracing going on.
Okay, so no tracing. Okay, well, thank you for your update from Greene County, and I'm glad to know that you all have communicated with the hospital, and that is a possibility for you. I want to just let Bernetta and Bob know that we have a guest on the line from AL.com. It's Amy Yerkinen. Did I get it right?
You did.
Okay, good. And she's on the line with us, and so we're going to go. We have Miss, for the first time, and Bernetta, this will be a familiar voice for you. This is Miss Carrie Fulgham from Sumter County, so we have Sumter County represented for the first time.
Yeah.
So, Carrie, tell us what's going on in Sumter County with COVID-19 and how you all faring down there.
Yeah. Well, excuse me. Before you go on, can you tell us what AL.com is?
Thank you.
Oh, I guess because I'm on Facebook all the time and always sharing that stuff. Would you tell them what AL.com is so that they will be aware of what your position is?
Yes. Hey, thanks for letting me listen in. AL.com is basically the website that has all the news from the Birmingham News, the Huntsville Times, and the Mobile Press Register. So we're just the Alabama media group, kind of just a news organization. So I've been covering a lot of COVID-19 and coronavirus, and I've been a healthcare reporter there for a few years. And I'm working on a story right now about the increase in the coronavirus cases in and around the Montgomery area. And I spoke with Herman Hardy earlier today, and I'm sort of just listening to see, what's happening in the Black Belt as well, and whether there might be some stories worth pursuing in the future.
Thank you. Okay, Miss Carrie. Okay, good afternoon, everyone. Sumter County, I'm kind of pleased they finally stepped up to the pot, and we have the testing going on in all the communities, like outside, not just in the county seat, but in all the local communities out in the rural areas. So, and we have about 5 different groups that's doing the testing. Hill, UWA, Watley, and we have another group, NAPS, and the people from DeMont, I forgot their name. But, at first they was moving kind of slow, but finally they started picking up, and now they're testing every week and in different sites and different locations. My only concern, like Carol, is they are still screaming, and if you don't have any symptoms, they're not testing you. And that's a concern of mine because, like you say, some people don't have symptoms, so I think it needs to be set up so that everybody's tested that haven't been tested. And we're working with different groups to try to do food, for our youth, for our children, and our elderly people. So the town of Gainesville and other places are doing food service. They'll do something on Monday to last them for the whole week. Just something to try to help them out, because a lot of our people depended on the free lunches and the free food programs in the school system. And we are also working with some other groups to try to get some fresh produce and different things in, which we're supposed to be trying to get out on Thursday, which Judge Montgomery and the Black Belt Community Foundation, I think, is doing that. So we've just been trying to be a contact person to try to, for my area, which is the north end of Sumter County, and with them. But, I am concerned that, our people just not taking it serious. I don't know exactly what we need to do. I've been like Carol, and some people been offended, but, you're trying to save lives. And I'm giving out masks and asking people to wear masks and stuff, all these gatherings. We're excited about graduations and all that, but we need to try to educate them in a way so they'll take this a little bit more serious because, it's a life and death situation.
Yeah.
Absolutely. Thank you, Carrie. I'm so glad that Sumter County is a part of the call. Yes.
And Norma, let me just add that with Green, we've also we've ended the school disbursement of food for the school year, but there is a supplemental program by USDA that parents, and I'm sure it applies to every county, parents can apply for this USDA program called Meals to You. And meals2you.org. You have to register for it. And USDA will enroll you, and meals will be delivered to the home where there are students. You have to have students. But it's called Meals to You. It's a USDA program. And when our school meals ended Monday, and we delivered from the time of the COVID, the schools were closed. We delivered 67,000 meals to our students in Greene County, because we were giving them meals for every day, 2 meals a day for every day. So, at least we were trying to feed our students. I just wanted to tell folks to check out.
That's good information to know.
Meals to You. It's www.meals2you.org or something like that.
Okay.
They have to sign up online for it.
Okay. I hope everybody's writing that down. I know Macon County was feeding, the school system was still delivering meals to you, but now that school is out, this is a good resource to know. Bobby, you want to say something related to that?
Yes, I was trying to wait my turn, but when the sister from Sumter County mentioned the Black Belt on Thursday, each county will receive, some counties are going to get more than others because we have been blessed with some philanthropists. And all the counties except Bullitt, I believe, because Bullitt didn't they're full a lot, will receive 1,600 boxes of fruit and produce provided through Frazier and some donors.
That's the Frazier Community Foundation, right?
It's coming to Greene County on Thursday,
All the counties on Thursday, Carol. All the counties Thursday.
Okay. Everybody got that?
People need to be aware of it. I don't know whether you should check with your local Blackbird associate to find out where it's coming in your county. It's coming to each county on Thursday. As with the exception of Bullitt, the other 11 counties are going to receive 1,600 boxes of food and produce on Thursday. Okay, someone mentioned, Carol mentioned mayors. I'm going to go ahead and do my little report because the Southern Council, she tricked my brain. Mayors, each county commission chairperson was supposed to come to Selma and receive mayors for their counties. The Blackbird Foundation again found a donor to donate mayors. But there really is no excuse why our folks won't have mayors because each county, so many mayors last week. And that was on Tuesday or Wednesday. In regards to mayors.
We'll be calling our commissioner tomorrow. Let us get through the county updates and then we can circle back around. Let me go to Dallas County. Ms. Perkins, give us an update from Dallas County, please, ma'am.
Hi, everyone. I'm glad to be on the call. I want to apologize for not being on the call last week. I represent Hale County Commission, and we were having a county commission meeting at the same time the call was going on. Testing in Dallas County, I think as I reported out the last time I was on the call, we have several different testing sites. We have testing every day in Dallas County. Main Street Clinic does testing every Monday through Sunday. We have the TJ Smith with the Rural Health Medical Program that's also represented in several counties that is doing testing, I think, on Mondays, if I'm not mistaken. And then there's another program through Walmart that's testing on Tuesdays and Thursdays, and then the health department is testing. I also was wanting, I got a chance to watch the Alabama Democratic Conference or Democratic Party, I'm not sure who it was Democratic something, had a webinar where there was a sister from the Department of Public Health on there, and she communicated that, and this is to the person that was mentioning earlier about the testing requirements still requiring symptoms. She mentioned that the Department of Public Health has relaxed those requirements, and people should be able to get tested now, regardless of their symptoms. If you've had contact, there's widespread testing for people in nursing homes. If everybody that works in a nursing home that has had at one positive case or at least contact with somebody that has had a positive case, the whole nursing home should be able to get testing. We're not doing that in Dallas County yet. What we're working on is, now that we have all of these available testing sites, we're trying to work on a coordinating testing plan to get our hotspots tested, like our manufacturing plant, Hammer Mill and American Apparel and places like that. We want to try to test all of the employees, and so we're trying to work on a way to do that. We also wanted to do some pop-up testing for essential employees, work on a campaign to direct them to one of these particular testing sites. There's information, there's money for everybody. The report out that I have right now from most clinics is that if you are uninsured, you should still be able to get tested and get your lab done to get the results from the test for free. There's money for the clinics for that. So if local clinics are having problems with uninsured people getting tested, tell them to look into that because that's available now. And so that's one thing we're working on. We're also trying to figure out the contact tracing piece because there's not a lot of talk about that in the state. And the key to us getting back to whatever our new normal is and getting on the other side of this is widespread testing, contact tracing, and then isolation for people that are positive to allow them to recover. And then, of course, the state practices with the businesses for reopening. So we still have our weekly COVID call every Tuesday at noon. I would encourage people to get on that call, even from other counties, because we do have a report out from the governor's office, the Jones office, and it was the state school board, but they haven't reported in a couple of weeks. That report out regularly on that call. This week, they were just, the Jones office, we're talking about the new bill that is passed the House that's waiting in the Senate and how that will affect municipalities around the state. There's money in there specifically for small municipalities with less than 50,000 people. So we hope that some version of that gets passed with those provisions in it. There was also a call that Hale County Chamber of Commerce did today that was just one of the best calls that I have been on. It was a call to provide support for business and industries. I think that was Ms. Zipper speaking. And so, hey, Ms. Zipper from Greene County, talking about her experience at Family Dollar. And that's been the experience around here as well. We do have the Black Belt Foundation doing a widespread dissemination of masks. We're trying to coordinate with churches to do some more widespread dissemination of masks. Albert Turner in Perry County and Ainka Jackson at the Selma Center for Nonviolence here in Dallas County are working to order mask supplies in bulk. So if some of you are having trouble with vendors and getting appropriate masks in, you can contact Ainka Jackson with Selma Center for Nonviolence or Albert Turner with Perry County. I know he's working with other counties to do that. It was announced on our COVID call today in different sectors in our communities that were having issues with masks, and I'll go through that one vendor to order in bulk for our county. So,
is there a cost? Is there a cost to that?
There is a cost. It is less than $1 for the surgical mask, and it's like $1 and something for the KN95 mask. Now, it is the KN95 mask, not just the N95 mask, so you'd have to get more information about that from them. But there is a cost for it. They're working with Black Belt Community Foundation with this initiative. So there are some funds available for some of this, but Ainka Sanders would be the contact for that. Or you can get in touch with someone from the Black Belt Community Foundation who will probably swing you back over to Ainka because I think they're coordinating that project together. The food service project through Black Belt Community Foundation and the Center for Nonviolence is happening here on Thursday as well at Selma High School at noon. For pickup, so that was announced today on our call. Our superintendent is working on some virtual learning plans and procuring some broadband access for our students in case we are not able to open back up. Appropriately, she has a committee working on that. I do think that that's something that there should be some multi-county Black Belt organizing around broadband access in case we have to continue remote learning, trying to work out some type of deal and getting a donor to work on getting devices to our students and getting those remote mobile, I think they call them Wi-Fi hotspots, where you can carry it with you and it creates the hotspot in your house as opposed to having to work through Spectrum and these other companies to try to get broadband access set up in the house. but there's a cost to that as well to return to work on funding for that. Back to this Hale County call that happened today to support businesses. On that call was Tim Crawley, the project engineer from the Alabama Technology Network, Alicia Hartley, who is an epidemiologist, and a principal consultant with Lakeshore Strategy, Joe Patton, who is the vice president and general manager of wood products with the Westervelt Company, Jimmy Swindle with the Westervelt Company, and Lavada Vidar, I think that's how you pronounce her name, who is the director of the Alabama Technology Network. On that call and that panel, they gave such detailed guidance to businesses as to how to open up properly, how to develop your COVID preparedness plan, what you need to be doing with your employees, what you need to be doing with safety. I thought it was one of the most informative calls that I've been on through this whole process, and I am now working to the call was recorded, which is great. I asked that, and they said that we can disseminate it. So as soon as I get that recording, I'll forward it to Mom Jackson. But I encourage you all to listen to it and to try to work toward developing some type of coalition of your business and retail community so that they can have access to this information. I think part of the reason we see these problems in Family Dollar and Walmart and people not wearing masks is because there's not a coordinated effort from the public to develop this plan, and there's no oversight from the government entities with the business entities in doing this because nobody kind of knows what they're doing. And so those people on that call were extremely knowledgeable and extremely resourceful. I also downloaded, there is a link where you can download the materials. They give reopening guidance. And so there's going to have to be some type of organized grassroots movement to, I don't know if you can do them through the chambers. It depends on what the politics are in your local community. But to get this information to businesses so they can keep the businesses safe. Because right now we are left at the mercy of these business owners, whether they're manufacturing plants, whether they're local retail stores, whether they're barbershops or whatever. We're left at the mercy of these business owners who have limited resources and have never been through this kind of planning before and probably never thought about how to have to do this before. And so that's a big thing for us. The courts are, of course, about to start reopening. So Judge Wiggins, our fourth circuit judge, is developing orders with the probate judges in all of the counties to develop guidelines for reopening government buildings, specifically the courthouse. And he's also developing an order as it relates to courts for that. So most of your presiding judges in your counties or in your circuits will be giving that guidance soon. I do think that in your counties we need to make sure we're checking in with the jails. Manufacturing plants, nursing homes, and jails we know are a hot spot. And all of these places should have preparedness plans that they can communicate to the public and they can be accountable to the public with. But I find that a lot of them don't know how to do that, which is why the resources on that Hale County call were so valuable. The Alabama Technology Network is offering free services to business of all types, right from car manufacturers down to barbershops, as to how safely the Alabama Tech. Let me make sure. Hold on. My notes. Alabama Technology. Hold on. Alabama Technology. It's those names I just called. Yeah, the Alabama Technology Network. And that would be Tim Crawley, who is the team leader, and Lavada, Lavada, Vidar, Vardar, who is the director. They have found some money to be able to, normally it's a fee for service that they usually do to go in and consult and walk businesses through this strategic planning and consulting, but they are giving their service for free. And I would just advise the local chambers and any type of organizing you can do around your businesses, getting them access to that free service, because it's invaluable to have a consultant come in and help you walk your business through what you need to do. The problem is that a lot of the business owners don't feel like they have to. They don't feel any pressure to. So you walk into a gas station, 10 people going in and out the door. Nobody has on a mask. Nobody but you have these same people that own these stores, and there's nobody telling them that you actually do have to enforce these CDC guidelines, and it's a problem if you don't, because it's an outbreak here to fix the whole community. So that's a piece that we're trying to figure out how, without how through our community, this community coalition that we're developing, we organize around that issue. Or how do we influence our mayor and government leaders to organize around the issue? Because our effort here is still very much grassroots, because it's a tense political environment, and so we're having to just kind of work from the ground up as far as organizing these things. So testing, contact tracing, food. We haven't gotten to what we're going to do to isolate people if we get that kind of outbreak and that kind of stuff. Our hospital is still doing well as of today. And I think that's about it for right now. I still need to follow up, since I was on the last call, with the people from Tuskegee regarding their testing initiative and contact tracing initiative, because that contact tracing is the piece that we're trying to figure out. The Department of Public Health is supposed to be doing it, but we don't have a lot of information about that. So hopefully I'll more about that on the next call. Thanks.
You can't stop you people from congregating. People are going to places like the grocery store and talking in the parking lot after they get the grocery. They just come. They have a 4th of July celebration. That's nothing's going on. I don't know what. I don't know how we deal with that. People is in the congregation more now in the world before the virus came in front of us. I think people is having a good time. Just congregating. The idea that the federal government, this is not just Boone County, it's the state of Alabama. The federal government sent money to each state. In Alabama, and I hope OIL reporter will comment on that. In Alabama, the governor and the legislature are arguing on how to dispose of the money. And some of the legislators want to build a new state house. We built a new state house not long ago. We moved out the old state house, and we built a new state house. They said that one is obsolete now. They want to build a new one. It's the third one. And Karen mentioned about the nursing home. Boone County has a nursing home. Boone County has a hospital. Some of that money is used to help defer costs of people going to the hospital who don't have insurance.
Okay, Ms. Parma from Lowndes County, tell us what's happening in Lowndes County.
Well, I was listening right now. I still don't think we got enough testing here. The only thing we're getting ours on through is through the health department. And they only have done like 2 testing since all this began. And the resources, I don't know how would you go about making sure that you get out to get some of these rural areas where you got these large communities where people have less access to get in, to get tested, because here in Lowndes, and I've been in Lowndes most all of my life, and a lot of people do not have access to get into these places unless somebody just go out and just let them know what's going on, what's the information about, because you hear it on the TV, and a lot of people don't even watch TV. A lot of the elderly people don't even watch TV. So they really don't know. So a lot of community here that I don't think that they really have resonated with how serious this is. I try to call people, talk to people on the phone and stuff, and let them know, if you're going to go out, protect yourself and protect the other person. And when somebody said about they got a food program coming up Thursday, this is the first me hearing of this, and I need to find out where the site will be in Lowndes. And I'm a pretty much active person in Lowndes County, and I hadn't even heard of that. Because I used to spread the word. When I hear something coming like that, I try to call a lot of people to spread the word to a lot of people. And also, I hadn't heard about the mask site at the Blackbelt Foundation. This is my first of hearing this. Most people that here in Lowndes, a lot of people had hooked up their sewing machine. Because I hooked up my sewing machine. So I'm making a few masks. I don't sew as well as I have been in the past, but I am sewing a few masks to spread them out in my community. So it's just
we got 5 churches, and people ain't been going to church lately, so so it's just been one of those things that you have limited access to information. Because usually when you get into church, everybody gonna know it. Because one thing about the folks in the black belt and in Lowndes County, they going to church if they can. But right now, most people just been doing what you call it outside service. And some people ain't doing it at all. Because my church, we just been doing a little bit of outside service, and you're not getting what you need to get like that. You're not getting it. And you got 4 or 5 people showing up of a congregation of 300 or 400 people. So you know you're not getting no info. So I didn't hear that. So I would love to try to find out where do I need to try to find out about that fight that coming up with the group that people say about it. And also you said something about the commissioner should know about the mask and by the Black Belt Foundation, and I got a pretty good relationship with my county commission chair, and I hadn't heard him say anything to me about it, so I don't know whether he know about it or not.
Yes, ma'am. So, your commission chair knows about it. Do you know Dickerson Farrell?
Yes, I do. I know Dickerson.
Dickerson Farrell, wife, Patricia on the Black Belt Board. She knows about the food. And your chairman of your commission should know about it.
Okay, so all I need to do is just find out from there. Find out where.
Man, I'm going to give you a number.
Okay, hold on. So, because I live in a pretty large community myself, and this is my first time hearing of this.
You got a pen now?
I got one. I'm going to write right now.
334.
Okay.
872. 1126.
Good information to be passing along. And anybody else who has not had information from your county commission or anybody about the food drop-off from Black Belt, to call that same number to find out what's going on in your county.
Right, but I just want to bring to your attention, especially the commission, the county commission may not be the best contact for dispersing something like masks. At our county commission meeting last week, I heard them say that, oh yeah, we picked up some masks for the commission.
Oh no.
And so I assume that they got masks for them to use and the employees that come in on a rotation. Yeah, but I'm saying they did not dispense or let anybody know. I'm saying that those masks, and I'm going to call Chris myself in the morning too, that these masks need to come to some community-based organizations that are working daily with folks in the community and can disperse the masks. You know, I've been paying for them. I've been buying the masks to give out. That's why I asked if there were masks that were available without cost, because I can't do that indefinitely. But if BBC have masks, they should not give them to the in Greene County. Do not give them to the county commission. Give them to those grassroots organizations that are truly working with the grassroots.
Will you call Christian Chemicals to give them to the commission?
I sure will.
Thank you.
All right. Well, we see we have some similar issues in most of our counties. Miss Earlene, how y'all doing in Wilcox County?
Oh, we're doing well. Our cases, we're up to about 95 cases, confirmed cases right now. So I think about 5 reported deaths so far. I guess like any other county or all around the world, we still have people that's being careless with the mask, and some wearing no mask and still congregating with the parties, social gatherings, and whatnot. So we're still dealing with that as well. As far as the county courthouse, it was supposed to open on yesterday, but due to the courthouse staff having to be tested on Friday, it postponed that opening date until next week if everything turns out well. And we'll get those directives from our presiding circuit. And we also still encouraging people to complete the census, still be mindful of the absentee voting that's going on, and praying that the cases won't get so bad to where death will start increasing as well. So we're just doing the best we can and praying that during this pandemic that we'll all be fine. With the information that people shared, will this be in an agenda or a type document or something?
Yes, it's being recorded by Mr. Frazier, and as soon as he gets to the editors and sends it to me, I will send it out to his committee.
Okay, thank you. Okay, well, right now that's all I have for Wilcox County.
Okay, and so thanks to everybody for giving their updates. I have one that was emailed in from Marengo County from Mr. Thomas Moore. He says, as of today, 843 tests have been completed in Marengo County. 116 people have tested positive for COVID-19 in Marengo County. That's quite a few. 8 deaths have been reported from COVID-19 in Marengo County. He put a note here. He says on May 19th, the highest single day for the number of there were 12 positive tests in one single day that has been recorded as of today. The previous highest day was an 8 positive tests recorded on May 5th. He says that the total of positive COVID-19 tests may be higher due to only those showing symptoms being tested. So his indicated even with 116 testing positive, it still might not be a representative number of people who are actually infected. So as y'all can see, we are not talking about a second wave yet. We don't know where our peak is at this point in the Black Belt, as far as I can tell, for the first wave. And we have opened up to, so our work is cut out for us. Someone dropped off a call. I'm not sure who it was. But Miss Amy, do you have any questions for anybody if you're still on the call, do you have any questions from anybody from any of the counties that you've heard from?
Yeah, I actually don't have any questions right now, but I was, I'm thinking about everything that I heard, and there's obviously a lot of kind of common threads that I hear you guys sort of tackling there in the Black Belt. So I'm going to definitely think about everything y'all have talked about, and I'd love to be in touch with y'all about following up on some stories later on.
Okay, well, let me give you my phone number so that if you need to contact me, you can.
Have you heard, Amy, anything regards to the federal stimulus money that the state is saying? How are we going to dispose of that money?
I don't know. I think the legislature might have approved a plan put forward by the governor, but I haven't been following that issue quite as closely, so I'm not 100% sure how they're going to spend that. I think our reporter, Mike Kaysen, covered that vote, so there's probably a breakdown somewhere. But yeah, I'm not really sure. I've been covering more the outbreaks in nursing homes and some of the manufacturing, the poultry plants actually, but I've been kind of looking at the healthcare response right now. So he's been a bit more on the political side and what the legislature is doing.
Okay, any other questions before she leaves?
No, I don't have any questions, but I have one other thing that I would like to put out there, Chief, here. Please be advised that I heard one of the ladies make the expression that she really didn't know what to do with people being careless. And the one thing that we are doing here in Macon County, we have put together a community education leaflet. And we got several organizations around the community to pay for the printing of it. It was in color. It cost nearly $900. But it is a one-stop information on just about anything and everything that's pertaining to this virus, including the city ordinance here that posed a curfew. Now, organizations stepped up to the plate to pay for the document, But since law enforcement is going to have the responsibility of following through with people misbehaving, we decided that the law enforcement, being the frontline force for the community, ought to be the ones who distribute this literature that we have. And we have 5,000 copies. We're going to use sheriff deputies, city police, and university police to move into communities and announce themselves with a blast. And then we're going to go door to door in all of our densely populated communities, contact the patriots or matriarchs of those, well, mamas and daddy, whoever's in charge, in those homes, give them this document, and then ask them to study this document with their family members, especially children. Hopefully, that will bring about a better understanding of the needs to conform to guidelines, as well as the possibility that the life they save may very well be their own. So we'll be busy on that later this week and all through the weekend and early next week. And some people may, if you, Miss Norma, have you guys' email address, I'll send her a copy of this document, and she can get it to all of you. And some of you may want to put together something similar to this. Now, what we have done with this document is we have the logo of every governmental power, as well as strong organizational power and influence, on the face of this document, to show that government and community has come together to save ourselves from ourselves. Go ahead.
Thank you, Chief. Any other information that we want Miss Amy to know? Okay, Miss Amy, thank you so much for being on the call. Ms. Parma, thank you for inviting her to the call, and hopefully we can create a relationship where we can get information to you, and you can share with us as well as in the future. So thank you again for being on the call. The only other thing that I wanted us to do tonight, and I didn't want to, go into our strategy session, and we're not going to be too much longer, but I wanted us to start thinking about last week. Dr. Dunn asked us to be thinking about a wish list of needs. I think we should start to compile what the needs are in each county. We had a county strategy meeting earlier that talked about the need to rehab a facility in case we need, because we don't have a hospital, in case we needed somewhere to quarantine people, or even in case we needed something like a field hospital. And so that's a need that Macon County has. If we could begin to compile needs and then compile a list of resources in each community, assets and resources, so that we will know what we have available to us in this 12-county region. We can be, just like tonight, we shared information that people weren't aware of, just continuing to build a database of information that will be helpful to us in the future. That's my piece to the strategy piece. But if anybody else, if we kind of can brainstorm things that we need to be putting on the list of things to do as we move forward.
I can, this is Lucinda Dunn. We are now doing a survey of our community with about the various buildings that we may have that can be retrofitted or renovated or any of that. We had a wonderful call today, just before I got on this call, with Dr. Crazy Daniels, who is one of the professors at Tuskegee University in the School of Architecture. And they have a number of designs that would be cost effective for putting together buildings or buildings of housing, but I shouldn't say buildings. I should say housing for those areas that do not have adequate places for people to be quarantined or even in terms of some form of medical services. Now, medical services is just tongue-in-cheek because we all know that's a pretty expensive proposition, and only if you're a hospital can you really even talk about designing a medical service in that regard. But the quarantine piece for those people who do not meet the requirements from the public health department, which is very stringent, and with Macon County is going through the same thing. What we have looked at is a pre-screening method for doing the testing, and then those who meet the public housing. I keep saying that public health requirements. We send them over. We've also started developing a infrastructure for doing the tracing, contact tracing, and all of that kind of stuff. So we're working on various ideas, and hopefully we can share some of those things with some of those ideas with other counties in the Black Belt. Everybody that I've talked to up to this point about how we can meet the challenge of the coronavirus have said not only Macon County, but all of Black Belt. So I think that we need to know that we are seeing ourselves as a community as opposed to just a group of counties. So I think that that's a really very important concept for us to continue. So we do have some resources in terms of brain power, innovation, and creativity, and we do have the sense of community that I am so proud of.
Thank you so much. And I just want to say that Tuskegee University, several departments at Tuskegee have been real lifesavers in terms of putting forth ideas and resources. The Department of Public Health, the Architecture Department you just mentioned, the School of Agriculture. So those are the kinds of things when we talk about resources in each one of our communities, we need to know what is available to us and where those resources are. And so if we can begin to develop those kinds of lists, I think that would be good. Actually, I think the last thing I wanted to mention was continue to think about this time next year, what is it going to look like? We see lots of things happening with funding and it not coming down and trickling down to us. We see lots of things happening with a lot of different things. But I want us to always keep in the back of our mind. I wanted Carrie to mention, she mentioned something to me this morning that they were doing in terms of gardening in Sumter County. Food security, y'all, is going to have to be at the forefront of our mind as we move on through this pandemic and beyond, because I just have a gut feeling that we are in for some pretty harsh times coming up. So, Karen, if you're still on the phone, could you just mention a little bit about what you all are doing in terms of community gardening?
Yes, that program and everything is working through the Federation of Southern Cooperatives, and we have a Gainesville Health and Wellness Center that is a member of the Federation, and what we started doing is promoting raised bed gardens for smaller spaces, and it's not as much energy needed to do it in raised beds, and you can do it in a small space. So we've been trying to educate people working with the NAPS Association to promote that raised bed project and to do that. And what we did is we did some demonstrations. We have an example of a raised bed project at the Wellness Center in Gainesville, and we have a community garden at another site over in Greene County. And we're working with the different extension services, all of A&M and Auburn University and everybody to try to promote that throughout the county and providing some resources for them to do it with. We've been building raised beds, and we've been getting dirt from the Miracle Grow Company up in Vance, Alabama, and just promoting this all over the county. So, I mean, it's just amazing what you can do in a small space. and how much you can feed yourself. So that's what we're promoting, and one of our biggest issues in our project right now is working on it, trying to educate our people. So like you say, I do too feel that we're going to really need to know how to not go to the grocery store so much.
I'd like to add to that, we in Macon County, through the Tuskegee Macon County Community Foundation, have given small grants to individual families. Right now we have 10, where we are promoting old-fashioned backyard gardening, but using biointensive methodology, as well as raised bed gardening. And I think that one of the things we might want to think about in the future is for the Black Belt to become what I'm going to call the produce bowl, and that we create an economic ecosystem. For an example, if you have greens, that you have grown enough greens for your county, but you got extra greens, where you go sell them? And though I know there are various outlets in various counties for doing that, I don't know how many. That's something we need to perhaps assess. But Tuskegee University has all kinds of ways to wash and prepare produce for sale on a commercial level. So I think it would be great if we could have that kind of conversation with the Southern Cooperative folk and our extension people at Tuskegee University. Terrence Jackson is doing an excellent job. He sounds like an little old man when I listen to him talk, because he talks about going back to basics, and that's what we have to do. If you got a backyard or a front yard, you should not starve to death.
Right. Great. So I am glad that Terry mentioned the Federation. That's another great resource that we have within our ranks as well. So we've got some resources. We just need to identify them and make everybody aware of what they are, and then work to do what we have always done, is taking what we have as the Black Belt theme and to make what we need. Thank you all for being here. We'll send the recording out when you have the notes. When Vanetta sends me the information from the call in Hale County today, I will send that out, and we will continue to think about how we continue to move this task force forward. If there's nothing else, anybody want to say a parting prayer for us? If you're still on the line, Bob, would you do that if you're still here?
Yes. Father God, we thank you. We praise you for being a holy and a righteous God. We pray, God, that the conversations that we've shared with each other will benefit humankind